Hello everyone, I'm Quang Chuan. Today I will present the project of electronic medical record analysis for cancer, which could be considered as an evolution of recording clinical data and opening the opportunity to cure the serious disease. My project will concentrate on the impacts in the cancer treatment. At first, I will talk about the project description. Following the Australian Institute of Health and Welfare, cancer is one of the most popular illnesses in Australia. Cancer could come from different causing factors such as smoking, alcohol, genetic problems, sunlight, and moreover, cancer is difficult to cure, keeping for a long time and expensive in treatment. However, researchers have proved that the early detection can bring more chance in curing and cheaper and shorter time of treatment. And electronic medical record analysis for cancer is a potential to solution to support the early detection process. Next, I will talk about the business model. At first, the project aims is optimization the treatment to cure more people from cancers and prediction analysis to increase the early detection chance. About the benefits, it can bring the benefit for health insurance with lower cost consuming for treatment. For doctor and a researcher, it could be a useful tool for diagnosis and making the clinical process. It can bring benefit for patients that the patient can get more chance to be cured and they can be survival for longer time. For public, it generates thousands of jobs in Australia from recruitment to construct and drive the system. However, there are also some undeniable challenges. It can be huge amount of raw data from different sources, require experts and high educated employees, and require data and medical professionals. The doctor may resist for to the process as well as the new system, so it requires the belief from people. Now I will describe about the characterizing data and data process. At first, about the characterizing data, data could come from different data sources with high rate of volume, velocity, variety, variability, and veracity. About data processing aspect, in computer and system, you can use BigRed2, a new grade supercomputer at IU. About storage, we can use Teradata, PostgreSQL, and MongoDB. In networking, there are various software we can use which ensure the significant I/O intensive process. And about software, we can use the popular software such as Hadoop, Hive, R, and Unix bases. Now I will demonstrate about the resources. There are various cancer data requests from different nation sources and especially from Australian Institute of Health and Welfare and the Australian Association of Cancer Registry. The Cancer Australian organization have classified and listed the main database sources. They are population-based cancer registry, which mainly used for surveilling health population and supporting the research. Clinical data registries, which mainly used for monitor and access the biospecimen of database and other cancer-related database such as Australian Bureau of Statistics and Medicare data. Finally, I will talk about the data analysis. The data of symptoms are collected and attacked into the related types of cancers. These data are linked and shared among the various sources. We could use the exploratory analysis and data visualization to understand and use the data effectively. There are some common analysis methodology we could use includes cluster and classify and periodic analysis. And this is the influence diagram. You can see that the different causing cancer factors as well as the result of previous tests takes the influence to the result of cancer tests. And this result, together with the data of cancer types, will support the oncologist evaluations. At this point, the oncologist can identify the type of cancer and stage in which the patient is. Then, based on the historical performance of therapies, we can select the most suitable therapy for the patient. The decision in taking the cancer test and select the therapy could affect directly to the cost consuming, the length of treatment time, and the patient health. At last, we should prepare for the different problems in missing and unstandardized data. Besides, projects should protect the patient data from external hacking. Moreover, it requires the approval of patient before it share information. Note that this information do not identify a certain person. About ethics, clinical data in project needs to be ensured to be used in the main purpose as supporting research and treatment for cancer. Thank you for